The source of a mystery case revealed another leak from hotel quarantine, the 22nd in Australia since the pandemic began.
We have now found a match.
Genomic has found an overseas traveller has the same sequencing as a West Melbourne family with the Delta strain.
I'm very surprised it got out, but this is what we have, and we need to try and work out exactly what's happened here.
The man arrived from Sri Lanka 1 month ago and was transferred by a Skybus to the Novotel Ibis Quarantine Hotel. He tested positive and the next day was moved to the Holiday Inn Health Hotel. He was released from hotel quarantine after a day 13 negative test.
While we are continuing to review CCTV and incident logs again, I can also confirm that so far there is no reported or obvious breach of infection prevention control.
How and when the virus leaked out remains a mystery, with all plane passengers, Skybus crew and staff across both hotels testing negative. There could still be a missing link, but theories centre on the traveller spreading it on the plane, in transit, in the hotels, or after his release from quarantine to his home in the Glen Ira area.
We have to run all those theories to ground. I think the least likely is that there's someone on the aircraft that's become infected and then been released from quarantine.
Residents that back on to one of the quarantine hotels where the man stayed raised concerns about contaminated COVID waste in their shared space last week.
How has this Labor government again let COVID leak into our community through yet another failure of Labor's hotel quarantine?
Hotels are built for tourists. They're not built for dealing with infectious disease.
Today's 2 new cases include a household contact of an Arcare aged care worker and a child linked to the West Melbourne outbreak. More exposure sites have been added, including a mass COVID vaccination hub after a positive case visited the convention centre after getting tested yesterday.
They were immediately directed to leave and to go back to isolation. And can I just say, for anybody who is a primary close contact or anybody who's a positive case, you must get tested, you must isolate, you cannot go to a vaccination centre.
The low case numbers mean lockdown is still due to end for Melburnians on Thursday night after a 2-week shutdown.
We remain on track to provide further easing of restrictions in regional Victoria and careful easing of restrictions in Melbourne.
Victorians are keeping their fingers crossed.